is Mark Ndingo, member of County Assembly of Kitui, elected in Yatta Kwavonza ward. Yatta Health Centre is a health facility in Kyusiani, and Kyusiani, being a sub-county headquarter, has never had a level 4 or level 3 hospital. We chose Kyusiani simply because it's a sub-county headquarters, and for any sub-county headquarter to grow, it must have a medical facility that is that can take care of its people. And given that we only had a health center, we had to look for a way of upgrading the health center to a better level hospital. So that's why we managed to talk with the governor, and he agreed to support the health center. And we did a female ward, a male ward, a maternity theater, as we plan to upgrade the hospital. These are some of the things which, for a health center to be upgraded, it must have some wards, it must have a theater, it must have an X-ray, it must have some of the things like an administration block, which we hope it will be done so that the level 4 health center can be achieved. Healthy community is a undeveloped community, and one way of enhancing our healthcare department is improving some of the facilities so that they can have better facilities, they can have better medical facilities so that they can serve our people better.
I'm Faith Kasaki, the facility in charge at Health Centre. I've served this community for some time, and it's my happiness to have served the community, which is very cooperative. The community is ready to get any service we offer to them, and ideally we've seen God's hand in the service delivery by the improvement of the service through Mheshimiwa Ndingo, who has been ready to work with us. Initially, after they assumed the office in 2022, we called him in the office and to explain our challenges as facility. And basically, he stated that he is ready to support, and where possible and feasible, he'll make the changes. One of the challenges was the referral system and the operation of the mortuary, and he meant it to his words that everything he stated in that meeting has been ongoing, though slowly, but to the perfection. In 2023-2024, Mheshimiwa came to our facility and came with the contractors for the renovation of the mortuary. Bear in mind that, in his words, during the initial meeting, he wanted to upgrade the facility to a level 3B and a level 4. And basically, he said that the mortuary will be operational to serve the people of Kitui Rural, and not just the people of Kitui Rural, but as far as Machakos and Makueni people who are getting the services locally from here. So in 2023-2024, the mortuary was renovated, and to his true words, the mortuary was operationalized in 2024 September, bringing 2 staffs, casual mortuaries, though they are morticians. And from that time, the mortuary has been operational up to date.
Tulikuwa naye hapa, then the familia ilichukua mtu wao na kutuletea nguo hapa. Nasubiri hapo nje dress, wanakuja wanachukua wanapeleka kwa dispatch. Sasa watu wameenda kwa dispatch, wameomba then una proceed wanaenda nyumbani. Those are recordings, sawa. Unasikianga the 24 bodies. Nakuanga na 3 chambers. Each chamber has 8. So the one is chamber has 8. This is one chamber. This is the second chamber. This is the third chamber. So the 24 inatokanga hapo. Depending on the chambers. Sawa. So after tunachukua mwili hapo kwa receiving, tunaletanga huku, tunaingiza huku ndani. This is the abandoned room that we may not access for now. But that the abandoned room is there. Hii gari ndio inaendeana kwa ward kama tu una receive mail from the outside. So you know, huwezi ambia relatives wa bebe mwili na mikono. So you receive them decently, unachukulia mwili na waletea huko ndani. If there's maybe unajua mwili inaweza kuwa imetoka maybe Nairobi na kuna mtu maybe hajaiona kama imetoka Singia, tuseme kwa Kitui na wewe umetoka Singia Nairobi. So after umechukua mwili unaileta huko ndani, unaifunika vizuri juu kama maybe anaweza kuwa na nguo, unaifunika vizuri, then unapelekea familia. Anaweza kuwa one of the deceased mwenye anakuja kumuona ni mtoto wake, so ile heshima tu ya kimtu unamfunika tu vizuri, then you present them to the family. So kulingana na nilikuwa ninawaelezea, agenda iko na 8. This one side iko na 4. Another one has 4. So according to the chamber, this has 8. The other one, the chamber 2 has 8. The other has 8. It gives you a total of 24 bodies. So that's 24 bodies inatokanga. Sawa. Yes. So as you have seen there down, the chamber, the Ndingo that you have accessed, as you have seen there down, the first chamber that is this side, that this is on our left hand that you have accessed. This is the machine that is using. So each chamber has its own machine. So hii machine na ile chamber tumefungua. Hii machine nyingine na hii chamber zingine, kuna hii chamber unaona hizi nyingine na hii nyingine ndio ile. Those are for the chamber that have increased one side. My name is Joshua Kavoka. I'm a mortuary attendant here at Yatta Health Centre mortuary. You normally receive bodies, do dispatch of the bodies, do post-mortem. Still, if the family is in the need of viewing of their bodies when they come, we still offer the same services. For one, we will take this opportunity to thank His Excellency the Governor, Dr. Julius Malombe, and our area MCA, Ndingo, for their effort that they have done to create this facility for the community of people of Kiusiani and the entire Lower Yatta. Because there was a challenges there back for the people of Yatta, they were taking their bodies from Yatta to Kitui County Referral Hospital, which was a challenge to them when it comes to the transport. We appreciate them for what they have done for this community. May the Lord help them. I'd also like to comment on the perimeter wall that was created here in Yatta Health Centre mortuary, which has already helped us because back in the days it was just a chain link that was there. And that chain link had no security. You know, when we are working in the mortuary is a place whereby when somebody is bringing his own body or is dispatching his body, means security. Again, here we are near a school called Yatta Primary School. So when we are dispatching or you are receiving a body, student or people are standing all over, all the people, strangers are passing by, it was not bringing a good picture. But when His Excellency Dr. Julius Malombe, together with our area MCA, Ndingo, planned and sat down and created the perimeter wall, we actually appreciate and we are happy for that.
My name is Dominic Makuti, the head teacher at Yatta Comprehensive School. We want to appreciate the county government of Kitui for constructing a wall around the mortuary. Initially, before the wall was constructed, there was a very huge outcry in the learning institution. Learners would not effectively concentrate in studies, particularly during the days when the bodies were being collected, because they drew to the site to watch whatever was happening. And this one was affecting the performance of the school. Number two, it was creating a certain kind of trauma, because most of the bodies that are being collected belong to relatives. Like there is a child who remarked that it was the uncle who was being removed from the mortuary. And this one sends a lot of trauma to the learners who are of young ages. And therefore, having such a situation posed very great danger to the learners and also to the community living around, because culturally, whenever a mortuary is around a residential place, people now tend to become very much afraid and timid, such that they feel they will be the next victims of the same. And therefore, we want to appreciate the government, the county government of Kitui, for constructing the wall. Now learners are concentrating in class. The trauma has now eased, and learners are no longer exposed to such a trauma. And therefore, we are very much thankful, and we wish that in future they can also extend the same to the school. They also construct a wall so that we have two entities that are not overexposed.
After he assumed office in 2022-2023, he also saw the need of giving us a male and a female ward, bearing in mind that the only facility which admits for the inpatient cases, it's in Kitui General and Kanyangi ward, which are so far. From here to Kitui General is around 40-something kilometers, to Kanyangi is almost 36 kilometers, which is very far. With the terrain, the patients have been suffering when we get the cases for admission. So we got the project from Mheshimiwa, the male and the female ward. They were readily constructed, equipped by the county government of Kitui through through Mheshimiwa. The wards are of capacity of 24, each ward bearing 12 patients. And later on, he saw the need of giving us a maternity theatre. This facility being one of the biggest facility offering maternity services, he gave the maternity theatre. It was also equipped later on.
My name is Japhet Muli. I'm a nurse here at Yatta Health Centre, Kiusiani. I would like to take this opportunity to thank our area MCA, Honorable Ndingo, under the leadership of His Excellency Dr. Malombe, for the tremendous development they have done in our area. As you can see, we have wards here in Yatta Health Centre. In the maternity department, it has improved a lot, because now we have the maternity theatre. Initially, we were transferring our patients, our mothers, to Kitui General, but now, after the completion of the maternity theatre, we will be able to perform all the cesarean sections here, and also our mothers now will reduce the transport costs. So this is our under 5 group, where you see the children who are under 5 years. So we can move to the next group. This room is an antenatal room and FP room where we see the mothers, and also we offer the family planning and advice. So we can move to the next room. In this room, we offer the weighing of the children, and also we manage them. We also have some from safety who are with their experience. So we have a staff here by the name Maitia. He is our nutritionist. This is the customer care room where we do registration of the patients before they go to the consultation room. So she's called Faith. So this is a consultation room. This consultation room 1. We have the staff here called Felicitas. So this is a consultation room 2. This is our pharmacy, where we do the dispensing of the drugs coming from the registration site. So see this lab. We have this guy here by the name Peter. How are you, Peter? Sorry for interruption.
Yes. Taking me for to end up no.
So we have another room here where we do the injections, we do dressings in this room.
Okay.
And even the minor surgeries, we also take them in this one. We have this is a counseling room where we do the HIV testing and counseling. Where we store drugs. The next room is the observation ward, where we do the stabilization of the patients. So if we get a patient who wants to be put in a stable condition, maybe we bring them here, we stabilize them before maybe we refer them.
When this government was elected, that is the county government of Kitui, under the leadership of Governor Dr. Julius Malombe, and I was elected as a member of County Assembly of Yatta. I talked to the governor about the health center, and I talked to him about how we can improve the health center to a level 4 hospital. He agreed to support the health center to be upgraded, and he provided funds for the development of the health center. That's how we got funding for the 2 wards and funding for the maternity wing. And also he provided funding for the mortuary, which had to be completed so that we can have it functional. Through his leadership, I also requested him to provide funds for the perimeter wall, which he agreed to provide the funds. And I can say the governor has really supported the facility, and I can say he has really supported my leadership and supported the people of Yatta Kwavonza in terms of development. And my vision is to have that facility, which is the only facility we have in the sub-county, even upgraded even to a better level, not even level 4, but also to a level 6, because the population in Yatta Kwavonza cannot be served by a small medical facility of that level of Kyusiani. So we hope and we pray that the coming government will give a lot of funding to that health facility so that it can grow to a better level 4 hospital. Within the sub-county, we only have one level 4 hospital, which is in Kanyangi, and the location at Kanyangi is somebody will have to walk for a long distance to get that medical assistance. So it will be better for the government to have a level 4 hospital in Kyusiani so that it can reduce the pressure of Kanyangi. It can also reduce the pressure at our hospital in Kyusiani and even other surrounding hospitals. And I'm sure even this government is going to put a lot of effort in looking for funds that can bring this dream of level 4 to reality.
Okay, the facility is growing fast, and we have a general population, a catchment population of about 7830. That is a very big population for the community, bearing in mind that we are at the border level. We are bordering Machakos, Makueni, and now Kitui, and we share most of the population. Having 78,000 patients is a big number, and it's one of the facilities in offer very comprehensive services. One of the services being the care and treatment to the HIV positive population, the maternity care to the pregnant mothers. We are basically giving delivery a maximum of around 10 patients in a month, and that is a big number to the population. The staffing has been very low, though we can't manage the whole facility after upgrading with 19 staffs, both cashiers, the non-support staffs, the mortuary people. We are all just 19. That is a very little number for us, and we can't continue having the same numbers, so we need more numbers to make the facility grow and to give the comprehensive services we've been giving. I've said we've been giving so many services, including TB care to our patients. We're giving mother and child care, including PMCTC. PMCTC is to the mothers who are having HIV. Their newborns are taken care of, and to give them a very good outcome. We have other services like the normal outpatient. In a day, we are seeing around 60 patients cumulatively, not counting the observations and the maternity cases. We're also giving nutrition services. On Wednesdays, we are running pediatric medical outpatient clinic. We have a specialist who come. During Tuesdays and Wednesdays and Fridays, we also run the medical outpatient clinics for both diabetes and hypertension. The clinicians are seeing the patients, and we have a workload which is growing, bearing in mind that those are non-communicable diseases. Nimesema we have a total care and treatment of around 354 patients. And bearing in mind that we've integrated the services, the queue is usually very huge for us and it's a burden. So we need some more staff to reduce the queue and to reduce the patient waiting time. We're also offering the record services. Medical record services are very key in the facility. They aggregate our data and give us feedbacks in every time. Nutrition services we are also offering, and immunization services daily. During the normal outpatient clinic and setup, when we see the very sick patients, those patients with high sugars, those patients who are traumatically affected by any condition, we basically admit them in our observation. So we are using basically the female ward to observe our patients. And currently we can get an admission, by the end of the month, we get like 28 patients having taken the observation services. You're only observing for 8 hours and we decide whether it's a referral or the patient has improved for home-based care. We're also linking with the CHPs, which are very crucial to us in the facility because we are communicating from the community level to the facility. So we are taking every asset as a key and crucial factor in the service delivery. So heko to Mheshimiwa, he has made a facility the way it is, and we want to congratulate him and say, in future, we expect that the facility is going to be operational, delivering all the services, both inpatient, maternity theatre services, and another needful service to the community. And that will be a plus to our community, and it will be very crucial as we, as a staff, will enjoy giving the services which are very comprehensive to the community, zenye tumekuwa tukitamani kupeana. So tunashukuru sana kwa Mheshimiwa kwa hiyo kazi yote amefanyia hii community ya Yatta. Kwetu kama healthcare workers, we want to congratulate him. Water has been the biggest challenge in the facility. Bear in mind that this is a semi-arid place. We are relying on rain harvested water with a capacity of 35,000 tanks, which basically can support the inpatients when we start operating with the wards and the theatre. So we could kindly request that, if possible, we get more water or an independent borehole. Thus, as the Safaricom Foundation will also add extra tanks, a 40,000 liters tank. Those are 4 tanks, but they won't be sufficient for the inpatient. So we could request if the county can do better to us, can even give an independent borehole, or give extra 40,000 tanks. We continue harvesting the rainwater to sustain the facility. When it comes to security matters, we are also having some challenge. Though Mheshimiwa did it well, he gave us 1 street light, which has been a backup light for the facility. We could request for some more in the facility, like 4 in every corner to get 1. And then, if possible, each building to get a floodlight to beef up the security in the facility. Mheshimiwa, we also having challenge with our cashiers. We only have 1 groundsman. The land in Yatta is a bit huge, and the cashier is multitasking, basically washing the facility and doing the grounds work, and that is a hard job to the cashier. We could request, if possible, the county to employ more cashiers for us so that we can hasten the work for the facility. And also bear in mind that it's a fast-growing facility. With more buildings upcoming, we require more cleaners to the facility. Also, the facility is very dusty. Basically, you can't work without dusting, so we would request, if possible, we also get cabros for the facility, and we'll appreciate so much. We also have a challenge with our kitchen, which is falling due to termite infestation. We will as well request that Mheshimiwa can provide a kitchen for our patients, because an inpatient without a kitchen, we can't survive. Then we also require some staff, additional staffs, after the facility has been upgraded to a level 4, so that we can work smoothly and give our services well. Staff quarters are still another challenge. Bear in mind that this facility has been runs for 24 hours in the 7 weeks a day, and the staff lazima achukuliwe nje, aletwe na watchman ndio apeane service, and that becomes very risky for our population, because most of the conditions inakuja as critical condition and emergencies. Now kitambo daktari aendewa akuje, things get worse. So we need a staff house for a standby doctor ama a nurse to address an emergency service. Okay, the other issue is a fence. Though we have a perimeter wall in the mortuary, the other side of the facility lacks a strong fence. So we request the county through Mheshimiwa to provide a fence and a standard gate for the facility, because inside we are doing well, but outside challenge kidogo. Ikanja ya kuingia hospitali. We also want it to be dustless. So recommendations, please address our challenges, and we will appreciate all services you've been giving to the people of Yatta.
Kwa masoto ndo fika nini wangena numeto to inwa mandu omundio no abika hospitali no akiusiani netete mwana akiwa na ina kwata witu museo ona nzinzi ya no kiti na abika hospitali naona improvement sende ba naona wards ya ome wards ya ka mochari niki wokuta bado nende kwitwa ningo na sino sende kwa hospitali ni ngo tungia FC tumobya makidingo ndo amondoleki ende ka hospitali no Yatta Health Centre mengo ata na Dr. Julius Malombe ko mo yako ndo aklamekita
kama sita ni Elizabeth Mwaini numeta ba Kiusiani no kirene mo wa pressure hiyo ndo lakini naitwa na ina nengo ndawa nitungia mo bya serikali itu kwa MCA itu Mheshimiwa Ndingo na Gavana wetu Malombe ngaya mwajime muno na muyende huo.
To the community on matters of health, I want to say the government is very committed in making sure that matters of health are given priority, and the government is also very committed in providing drugs to our health centers so that our people can get those services when and whenever they need them. So I want to say that we pray that our community is going to be patient as the government continues to find ways of improving our health facilities.